Good morning, everyone, and thank you for joining us at King's College Hospital's webinar. Today, we have the pleasure of welcoming Dr. John, specialist neurologist and movement disorder, and Cortezia Miranda to discuss multiple sclerosis awareness myths versus facts. To start today's proceeding, Cortezia, over to you.
Thank you, Nada. Okay, so hi everyone again. I'm so happy that we're doing this again with King's. Thank you so much for having me and for doing this for MS awareness. And I'm so glad that we're doing this topic of myths versus facts because there is so much of darkness around this topic of multiple sclerosis. And once you get it, is it fatal? Is it not? What can you do? What can't you do? And things like that. So I'm really glad that Dr. John is helping me out here to myth bust. And I've got 13 myths. We're going to see what's right and what's wrong. Okay, so we're going to get into it with myth number one, or fact. People with multiple sclerosis can't or shouldn't be physically active.
Well, thanks so much, everyone, for joining us. And thanks, Cortezia, for anchoring the program, and thanks, Nada, as well. Well, I think that's obviously not true. People with multiple sclerosis should be active. It used to be thought that physical activity or exertion could potentially make the symptoms of MS worse. But then research has been done in this area, and it's actually shown that there's a lot of benefit that can come from being physically active and doing exercise for patients with MS. First of all, we know that in the advanced stages of MS, there tends to be spasticity problems with mobility, and all of that. And physical activity can indeed help to, ameliorate these symptoms, reduce spasticity, improve mobility, and improve quality of life. Mm-hmm. And at the same time, the fact that somebody has got MS does not, exempt them from the other possible problems that can happen with sedentarism, like, cardiovascular problems, hypertension, diabetes, and all of that, and heart issues. So being physically active, helps to mitigate all of these problems. So there's a lot of benefit from it. The precautions one has to take is just that there's scientific reason to believe that some symptoms of MS can potentially get worse when the body temperature is high, or when exerts oneself to the point that the internal temperature rises. In fact, some people say they get some blurring of vision and some of their symptoms get worse. And this has been described as Uthoff's phenomenon. So the precautions one would just advise would be things like ensuring that one exercises in a cool environment. Do not do it in the hot afternoon or in a very hot environment. But exercise is encouraged. Then you can use cooling towels and all of that during exercise. Take cold water, and after exercise, stay in a cool place. Use your AC and all of that. So exercise has got a lot of benefit, both for physical well-being, mental well-being, and all of that. So it's encouraged. You have to be physically active. In fact, everybody has got to be physically active.
Yeah, exactly. I found that when I am physically active, I just feel a lot better physically and mentally. And yes, about working out in an AC environment, heat is just not a friend of MS. Okay, so myth number two, the risk of getting MS is all in your genes.
Obviously, that's not true. The risk factors for MS is there are actually a lot of them, and we cannot pinpoint a particular one as saying that this particular factor is what is most responsible for MS. It's not like a cause and effect relationship that we can draw in the case of heart failure or stroke, that we can say it's caused by hypertension or diabetes. So MS has got a multiplicity of risk factors, and they interact in a very complex manner. and nobody really knows for sure what causes MS. We can only say what we've observed. So the observation is that if you've got two twins that are identical twins, what we call monozygotic twins, if one of them has got MS, then the chance that the other twin is going to have MS is much, much higher than the risk of the general population. I think the risk for MS in the general population has been estimated to be about 1 in 1,000. That means 1 in every 1,000 people have the risk, and then females are at a higher risk than males. So genetics definitely plays some role, but so if you've got your relation or if a sibling has got MS, maybe your risk is higher than this of the other people in the street, but then it doesn't necessarily mean that you're going to have MS. And again, it's not a transmissible disease, so I wouldn't say it's in the gene. So it's a multifactorial, disease, as it were.
Yeah, I remember it because it was such a shock for everyone in my family that, you start going through your family records and your ancestry, thinking who in the families had it or suffered nerve problems. I know my great grandma used to complain about nerve problems, but back then who knew, right? But yeah, of course, it's good to know these things. And of course, we know that we don't know what causes MS yet. So we can't really just pinpoint it on that. Okay, so number 3, there is an MS specific diet. Is there something that we can say all people with MS need to follow this specific diet?
Unfortunately, there is none. It's not like diabetes when you say you're prescribing this kind of diet, everybody with diabetes follow this diet and it would help, reduce your medication requirement, help maintain your blood glucose and stuff. So I think the general precautions in terms of healthy eating is what I would recommend for multiple sclerosis. The only thing I think that's got some relationship with MS that we talked about are probably 2 things. The first one would be obesity. One is to be careful to not be obese. And again, obesity has a lot to do with diet. So obesity has been found to be a risk factor for MS. Again, the fact that I said obesity is a risk factor for MS doesn't mean that all obese people are going to have MS, and it doesn't mean that obesity is a major risk factor. But then we're just looking at multiple factors that tend to be, that tend to predispose to this disease. So obesity plays some role. So we need to watch out and be careful, about high calorie diets, and then making sure we balance our nutrition properly. Now, the second thing is vitamin D. I would recommend vitamin D supplementation in those who've got MS because, well, like Cortezia said, we don't really know for sure what causes MS, but we know some risk factors for it, and vitamin D has been found to be, low vitamin D levels has been found to be associated with an increased risk of MS, and possibly with a more severe form of MS. So if somebody has got MS, I would recommend them to take vitamin D supplementation. Other than that, I don't think there's any special kind of diet that it's meant for people with MS.
So, Doctor, sub point to this. I've been told personally that things like sugar, gluten, and dairy are inflammatory foods, and therefore having an autoimmune disease, you should keep away from these things. So is this true or false?
I wouldn't say that. I don't think it's got much merit behind it. We need sugars for sure in our diet, and at least 50% of what we need to balance our diet comes from the carbohydrates group, and sugar is one of them. Of course, what I would say is refined sugars, probably that's what you're referring to.
Yeah.
So this should be taken in moderation. I mean, one should be careful with them. They can increase the risk of cardiovascular disease and all of that. but them being pro-inflammatory, I think there's a need for more evidence behind this. I think there are more serious issues in MS than just to link things to refined sugar. So I don't think refined sugar has much role in exacerbating MS or making it worse or more severe. I don't think so.
Okay, and what about dairy and gluten?
Gluten, if you do not have gluten sensitivity, I don't think there's a problem with that. We haven't found any serious association. Whatever association that's been, whatever association that's been, thought about or thought of is probably very weak. So I don't think it's something to take really seriously.
Okay, and would you know about dairy products as well, milk and cheeses and yogurt?
Oh, no. Certainly, yeah, what I'm going to say is yogurt, for instance, is rich in fat and all of that. It definitely, MS is a demyelinating disease. So, and during an attack, when you have demyelination, at the recovery phase, you have remyelination. So for you to recover, there has to be remyelination. And for remyelination to occur, myelin is made from lipids and fats and all of that. So we need adequate consumption of fatty diet as well. So there's a proportion of our diet that has to be fat, a proportion that has to be carbohydrate and all of that. So all those things have to be balanced. So I would not place too much emphasis on food.
So I'm sorry, I'm gonna step away from the questions for a second and ask, remyelination, I like that word. What are certain foods apart from, you said, so milk, dairy and things would aid. Are there any other types of foods that would help us in remyelination? Because we'd like that.
Certainly, I think multivitamins would also help. So I would recommend multivitamins. I would recommend adequate rest. I'd recommend balanced nutrition. So everything has to be balanced. You have an adequate proportion of carbohydrates, fruits and vegetables, fats, and all of that, and protein.
Okay, great. Thank you so much, Doctor. All right. Next question. I can't do anything to help my MS.
Of course, you can do quite a lot. So basically, MS care has come a long way from the 90s up till today. So both in terms of the medical care and in terms of the other things that can be done to care for MS. And these days, in the track record of development of medications for multiple sclerosis, we've come really close to medications that can potentially put out the fire. I'm not saying cure, but then something close to that. So we have very, very highly efficacious medications that can actually help to mitigate this disease in the early stages. So to say one cannot do anything about the disease is definitely very wrong and not acceptable in this day and age. Quite a lot can be done. I understand that it's a progressive disease, but then a lot can be done to slow down the progression. So I wouldn't agree to say there's nothing you can do. Quite a lot can be done. So to stay active for as long as possible, to avoid disabilities setting in as much as possible. So once a diagnosis is made, the right treatment has to be instituted and tailor-made to the individual. If you've got a very highly active disease, then a highly active medication is instituted. If you've got a moderate disease, give you a moderate medication to make sure the disease is kept under control. Because again, what drives progression and disability is when the inflammation continues and loss of brain cells or spinal cord cells continues unabated. So this would go effective medication. So definitely a lot can be done. And again, the non-medication aspects like regular exercise, aerobic exercise, the right kind of diet, and they're staying mentally positive. All those things are very, very important.
Okay, great. Thank you, doctor. MS will shorten your lifespan, true or false?
Well, this is linked to, very much related to the question we just addressed now. I don't think it is necessarily so. Probably in the days when there were no treatments for MS,
Yeah.
or when we had only medications that had very limited efficacy, probably that might be true. But these days it doesn't have to be so. So with the highly efficacious medications, I think life expectancy is very, very good.
Yes, yeah. Thank God for that. I know it used to be really bad. People with MS shouldn't have flu shots. I really want to know the answer to this question.
No, MS patients can actually have flu shots because generally speaking, we have two types of vaccines. Okay, we have live attenuated vaccines in which you're being inoculated with, more or less like the actual organism itself, like the virus, but like a form of it that has been made to not be, disease causing. So that you inject it with the organism, but it wouldn't cause disease in you, and that's going to provoke your body's immunity to produce antibodies and all of that. And the second type is what we call the inactivated vaccine. So the inactivated vaccine, actually, they're just proteins derived from the virus that is injected into you to provoke antibody response to protect you. So the inactivated form poses no risk at all of infection. So the live attenuated, of course, can potentially cause infection if your immunity is low. And since patients with MS take medications that tend to suppress the immune response or the immunity, so most of the time for vaccines that are live attenuated, we tend to make sure we give these vaccines before they start disease-modifying treatment. But for vaccines like the flu shot, which is inactivated, so there is no risk at all. So MS patients can take inactivated vaccine. There's no risk of causing disease.
Okay, great. Thanks. Brett, so how do we know then that we're going in for an inactivated one? I mean, when we're going in for our flu shot, are they gonna know, or how does it work?
Okay, flu shots by design are usually inactivated. The injections are usually inactivated by design, so you don't need to bother about that. But then if you want to travel, for instance, to other countries and vaccines are made mandatory for you, I would recommend that you speak to your physician, you speak to your neurologist before taking any potential vaccine. Let your neurologist advise you on it. So we definitely know, we can decipher which ones are live attenuated and which ones are inactivated vaccines, and which ones are safe and which ones aren't safe, and we can advise accordingly.
Okay, great.
So, but for sure, flu shot is very safe. It's inactivated.
Good, because I remember the last time that I was up to get a flu shot, a lot of people were telling me, don't get it, you're at risk, it doesn't make sense. So I was very conflicted at the time. I think that while we're on the subject, I was going to ask you this question at the end, but I think I'll ask you now. Is it true that people with MS are more susceptible to getting COVID since we are immunosuppressed due to our medication? And also, answer this, and then I'll ask you another question.
Well, so far, the guidance we've gotten from international communities of experts looking after MS patients and the community of neurologists globally shows that actually the MS community might have less predisposition to severe forms of COVID-19. And so far, it looks like the risk of contracting the disease is probably not any different from the general population, but the risk of having a severe form of COVID-19 is probably less in MS patients. And the reason that's been postulated is that what drives the severe forms of COVID-19 is like an exaggerated immune response, what they call the cytokine storm. So, but then because MS patients are already on some form of immune modulators or immune suppression,
Exactly,
so this kind of exaggerated response does not occur, and so they are less likely to have the severe form of COVID-19. And overall, so far, it doesn't appear like the MS patients are more represented in the pool of COVID-19 patients that have been seen so far. So there shouldn't be any fears. Although we've been advised about certain medications that we should not start during this period of a pandemic. Probably we can consider alternative medications because probably they can potentially reduce the chances of forming protective antibodies against any potential pathogen like COVID-19.
Yes, I know that I've heard that it's not very wise to start Ocrevus at this time. I don't know if you.
That's
right,
correct.
Yeah.
That's
okay.
correct.
Yes.
Yeah.
And also on that topic, so once we do get a vaccine for COVID, do we know? I know it's too early for us to say anything, but is it the same for people with MS, with autoimmune diseases, or how do we know anything?
Well, for now, we still don't have vaccines yet.
Yeah.
So, so we don't know what form the vaccine is going to take, but it could be the inactivated form of the virus, probably some viral antigen will be used as vaccines. But let's wait and see. So if it's the inactivated form, then there will be no debate at all. So it will be safe for all and sundry. But then if it's live attenuated, then further discussions and further research will need to be, looked at. And one would have to look at risk and benefit. This is always the situation. There's almost never a right or a wrong answer. But for every given circumstance, we have to look at what are the benefits and what are the risks. And if the benefit outweighs the risk, then why not?
Okay, great. Thank you, doctor.
So
multiple sclerosis is not associated with cognitive impairment. True or false?
Well, that's probably the answer to this is probably not very straightforward. What I would say is, in terms of association, definitely there is an association between multiple sclerosis and cognitive impairment. We have found that beyond just the inflammation and the relapses and remissions occurring in up to 90% of multiple sclerosis patients, there's also some kind of brain volume loss that occurs, that starts early and that goes on. And that has been associated with some form of cognitive impairment. Even the bulk of the activity seems to occur inside. The brain has got two parts. We've got the gray matter, which is the covering of the brain, and then we've got the white matter, which is like the remaining substance of the brain. So the gray matter, which is like the outer part of the brain, there is some degree of loss of that going on. And the white matter as well, where the bulk of the activity of MS, the demyelination and all of that occurs, also is being damaged and all of that. So all of this contributes to cognitive, some form of cognitive loss in MS. So, but then saying this doesn't mean that we should be afraid. What's most important is we need to stay on the disease-modifying therapy. We can potentially, mitigate this process, slow it down, and then ameliorate whatever cognitive consequences that would have occurred if one had not been on them. But it's important to know that certainly it's well documented that there can be cognitive impairment as an association of multiple sclerosis.
Okay, are there any like for our physical, whenever we have any problems with our legs or hands or anything like that, we have physical therapy. Is there anything that we can do for cognitive impairment?
Well, I think the main things would be the therapy is important. One has to be really committed and motivated to stay on therapy. The second thing is how early these medications are started. So as soon as the diagnosis is made, it's important to have a discussion with the physician to select, the neurologist to select the right medication and to stay on them. And then right nutrition that we mentioned before. And then preventing other cardiovascular risk factors like hypertension, diabetes, cholesterol problems, all of which can cause, vascular damage, can cause, strokes, can cause loss of brain matter, which can potentially make the cognitive problems to appear earlier. So, and then right vitamin supplements, being mentally active, all of these are very, very important. Being socially active, mentally active, all of these are very important. And physically active as well.
Right, but okay, I think I've got it. I just want to pause here. If anyone here has any questions, if you could drop them in the chat, I think our doctor would be happy to answer them once we're done with these questions, because I might not have everything covered here. Okay, so I've got a couple of questions about women with MS. So the first one is, women with MS shouldn't get pregnant. Is that a fact or a myth?
I think it's a myth.
Okay.
Certainly, see, you're excited about that. So, certainly, patients with MS can get pregnant. And these days, there's been a lot of new knowledge in this regard. And a lot of MS physicians and neurologists are aware of what to do. And typically, when we are faced with women of childbearing age and they've been diagnosed with MS, usually we have a discussion in terms of what medications they should be on and which ones they should not be on in case they get pregnant. And when they do get pregnant, they need, as early as they discover that they have gotten pregnant, they need to let the physician know. So they need to modify the medications. There's some medications we need to switch, There's some that are safe in pregnancy, there's some that aren't safe. And then as pregnancy advances towards the end of pregnancy, there are also modifications that need to be made to the medications, and then during breastfeeding and all of that. So certainly MS patients should have a reproductive life. It's okay. They can have their reproductive life. They can raise their families. There's no problem at all. There's no restriction at all. So it's just a question of the neurologist being actively involved. And we also encourage that MS patients should plan their pregnancies. So when you are planning to get pregnant, get your neurologist informed, and he can make the necessary modifications to your medications to make sure that they are safe for in pregnancy. For instance, if you're taking, I'll just talk about one particular medication. If you're taking Obagio, for instance, Obagio is one of the medications we use in MS, and especially moderate MS. So Obagio is not safe in pregnancy. So if for any reason a lady of reproductive age is on Obagio, so it'll be important to let your physician know when you're planning to get pregnant, so your doctor can have time to stop the medication and then wash it out of your system, and then probably replace it with safer medications and all that.
Okay, all right. So just to just so I've got that right. So before you try getting pregnant, you need to get off certain medications. Well, not all of them. You just basically have to check with your neurologist.
Yeah, certainly.
Oh, great, good to know. So and you also mentioned about breastfeeding. That was actually my next point, that women with MS can't breastfeed, but you did say that everything should be normal. They just have to keep in touch with their neurologist. So I think that this next one is we know multiple sclerosis is contagious. We know that it's a myth. But is there anything that you want to add to that?
Oh, well, it's not contagious. Certainly, it's not. So you don't have to be afraid if your housemate or your close relation or your family member has got MS. The chance that whether you can contract MS from them isn't there at all. It's not an infectious disease. It's not contagious. Okay.
Yeah, we know that. Okay, the next one. MS will make you permanently disabled. Is that a myth or fact?
Well, it's not necessarily so. We've got a lot of disease-modifying medications these days, a lot of very, very highly active medications. And there's a lot of debate going on. The traditional approach used to be, we have like, let me say, an hierarchy of those medications from the lowest efficacy to the highest efficacy. And we tend to start with the least efficacious medication, and then we see how the patient responds. If you're not responding well, you're having frequent relapses and all of that, then we escalate to a higher level. But I think there's a lot of discussion going on now that we probably need to reverse the pyramid. That you don't have to wait for people to have multiple relapses before you go to a highly active medication. Why don't we start out with a highly active medication to wipe out the disease and then probably step down? So that's like the reverse pyramid. So this is still being debated amongst MS experts, but the consensus now is that treatment should be tailor-made. So from the beginning, we should identify those who seem to have mild disease, and then go after it that way, and then identify those with moderate disease, identify those who are likely to have an aggressive kind of disease from the beginning. And if we identify such, we don't need to start them on low efficacy medication. We just go straight out to high efficacy medications, and that's the way it is. So the whole essence of all this is to make sure we prevent this adverse endpoint of disability progression in multiple sclerosis. So if you are, let me use this word, somebody said you have to teach a child to be gentle with the gentle and to be aggressive with the aggressive. So if you identify an aggressive disease and you are aggressive with it from the beginning, then you can potentially prevent a disability outcome. So this is the point. So, and this is the point behind the monitoring of the disease. Each time you visit your neurologist, we tend to look at what is the relapse rate, any relapses in your medication, any cognitive decline, we tend to monitor that, any physical disabilities, and then we look at the MRI periodically to look for evidence of disease progression, because the target is to have no evidence of disease activity, which we call NEDA.
Okay. I have a question here. Only older people get MS. Now, this is, I think, along the lines of, how the older people are more susceptible to, say, COVID, etc. And I think maybe there's a myth that if you're older, then you're more susceptible to diseases, example, MS. So is that a myth or fact? Tell us. I'm 20.
Sorry, I think there's a question I was trying to read on the screen. Someone was asking about Tecfidera. I didn't quite see that question. Can you see the question on your side?
Yes. Yes, someone's asked. I was on Tecfidera all of last year.
Okay, okay. I just wanted to be sure you can see it. Let me just take the question with your question, then we can go to that.
Oh, okay. Great. So my question was, is it a myth or fact that only older people get MS?
Oh, no, it's certainly not true. Even in children, MS has been found to occur in children. So nowadays we've got pediatric MS and we've got adult MS. And the span for adults is between 11 and about 55 or so. That's the time of onset of the disease. So it's not just the older people that can have MS, so it occurs in children as well.
Okay, yeah. I think we can go to this question now. Here we are. So Chand has asked, I was on Tecfidera all of last year and I stopped cold since Feb without consultation and I feel fine. Any precautions I should take or recommendations? No symptoms have returned. I think that is amazing. Thank goodness for you.
So, well, this is in line with what I just said before about reversing the pyramid. You know, the whole point in MS is, even though we know that MS is associated with relapses and remissions, and then the symptoms you talked about are the relapses, okay? So that you've not had any of them, this is absolutely fine and fantastic. Now, the whole essence of putting people on disease-modifying treatment is to prevent relapses and to prevent disease progression. So it looks to us as if there are two independent processes going on, or probably interrelated, maybe not exactly independent, but there are two processes going on in MS. There are relapses going on, and then there is also a smoldering you know, progression and loss of brain volume going on, which is responsible for the cognitive impairment that we talked about. So these two things need to be addressed. So when we place people on disease-modifying treatment, one of the endpoints or one of the focus, one of the goals is to prevent relapses. So the fact that you don't have a relapse right now does not mean you should stop your medication. So this is the reason for starting you on the medication in the first place. We want to prevent the relapses from occurring. So if you're waiting for the relapses to occur before taking the medications, then the whole essence is defeated, because we don't want you to have those relapses. Because after every relapse, even though there is some remission, you may not return to exactly the same level of functioning that you were before. I'll give you an example of a young man that I know that I looked after. He actually was diagnosed with MS probably like 3 years ago. And at that time, he had optic neuritis, and he had some blurring of vision in one eye and painful eye movement, which recovered over a couple of weeks. And he was started on Gilenya. And then after some time, he felt absolutely well and had no symptoms whatsoever. And he decided to stop his Gilenya. And he was fine for a couple of months and he felt perfect and he did nothing. And then until one day he had unfortunately had another optic neuritis in the same eye. And so even though we started him on steroids and all of that, but then he had remarkable loss of vision in that eye. And then I'm not sure whether he would be able to recover 100% vision in that eye. It might have some recovery, but may not be perfect. So the point is, we don't want accumulation of disability. So I would not encourage you to stop your medication. So I would encourage you to see your physician to check again. So sometimes, even though there are no relapses occurring clinically, subclinically, if you do your brain MRI, if you compare against the previous, you might see evidence of some activity going on. So the whole essence is we wanted to reach a point of having no evidence of disease activity. So it's important for you to see your physician, let him repeat your brain scan, and compare with the previous one, and then advise you accordingly. So I wouldn't recommend that you stop your medication.
Thank you, doctor. I just want to check again, but it is possible to get off medication eventually, because I have heard of people who have come off their medication, and that is the goal.
Well, certainly, I'm not saying that that's not a possibility. Again, that decision needs to be taken, under the supervision of your neurologist. Certainly, again, like I said, we've got different types of MS. In terms of MS severity, there are those who've got very mild disease, there are those who've got very moderate disease, there are those who've got aggressive disease. Some people with mild disease have, relapses that aren't very frequent. Maybe they have one relapse and then they don't have any other relapse until after 2 or 3 years or whatever. So you know that this kind of person has got a very, very mild disease. So you might begin to debate that whether it is really very necessary to place them on this medication or not. And if you decide to not put them on medication, then you would advise to monitor the disease very closely. Maybe your neurologist would choose to, monitor your disease every 6 months or so, to do your MRI and follow you carefully to be sure that you're not having progression. So if the medication is stopped, I would personally advise that the disease needs to be monitored probably every 6 months to be sure you're not having subclinical relapses, and then cognitive function would need to be monitored as well. So then the other thing is there are some medications also that are highly active, which patients do not have to continue taking for a very long period of time. Sometimes you give them for over 2 years and you wait, or you give them for a certain number of years and you stop completely and wait and see what happens. Certainly there are situations or scenarios where you don't have to continue to take medications. I know cladribine is one of such, in which you give for a while and then you wait and see what happens. So, but then all of these have to be taken in the proper context, and you have to be guided by your physician. So if you've stopped taking, I think you stopped in February, and this is June, this is July, so it's been about 5 months now. So I think 5 months is too short to decide whether or not, there's no repercussion for not taking medications. So, but whatever it is, the patient is usually at the center of the decision. So if you have chosen that you want to, stop the medication or hold on for a while, I would suggest that, of course, your decision is important, but I would suggest that you should be supervised by a physician. It should be followed.
Okay, thank you, doctor. I just have a final question, and then I think we can wrap up. So,
okay.
Can you work with MS, and what kind of jobs? Personally, I know a lot of people who do have full-time jobs with MS, but as we know, it's a snowflake disease. No two cases are the same. So what's it like? Right now, I'm not working. I had to quit because of MS. So what is it really? Can you work with MS? What do you advise?
Well, I think these days of COVID-19 and the era that's coming after the post-COVID era is probably going to unfold a lot of new opportunities in terms of being able to work from home and work virtually and all of that. So this is probably going to reopen a new chapter. One thing I know that is not a friend of MS is stress. So if your work is very, very physically demanding, that can potentially make your disease worse, and you may not be able to cope. So I would suggest if it's possible to do things that are less physically stressful, I think that will be fine. Even if it's mentally engaging, I think that is good. I mean, MS, I encourage people to be very mentally active, and that's also going to help to preserve cognition. There might be people who think otherwise, that mental activity probably doesn't prevent cognitive decline or whatever. But I strongly think the more mentally active we are, the more reserve we build. We build in a cognitive reserve, and that's going to help slow down or prevent cognitive decline in the future. So in summary, what I'm trying to say is less physically demanding jobs. Probably, I think teaching will be fine, in which case you just go for a given number of hours and teach, and you're back to your house. And what's very important is don't overstretch yourself. Don't go beyond the limit. Know your physical endurance ability, and don't go beyond that. So I wouldn't say that you shouldn't work because of MS. I think there are things that you can do. But then it's important to find out what you can do that would not be too physically demanding. Probably that wouldn't take your physical attention from 8 to 5 p.m., which is a typical thing, or that will keep you awake at night. So those kind of jobs will not be recommended.
Okay, great. Thank you, doctor. So I think with that, I'm done with my myths and facts. Is there anything else that you want to add, doctor?
Well, I think there's nothing else to add other than to thank you for the initiative to have this program, and to thank all of our listeners, and to thank the organizers, especially Nada, who's been quietly working in the background. Thank you so much, everybody.
Thank you. Thank you, everyone, for your time, and we hope this has been beneficial, and we look forward to welcoming you again to our next webinar.